True or false? Obesity is purely a result of poor diet and exercise.
False.
Right or wrong? GLP-1 medications are just for weight loss.
False.
Number 3, yes or no? Can someone have a normal BMI but still be metabolically unhealthy?
That's yes, true.
Number 4, true or false? Stopping GLP-1 medications always causes weight regain. Hello and welcome everyone to another episode on Hormones and Hope. I'm very, very excited, and as promised in my last episode where I talked to you about GLP-1, I'm bringing you one of the very well-recognized obesity medicine specialist physician, Dr. Sodhi, to add on to plethora of knowledge as well as answer your questions today at our episode Hormones and Hope podcast. So welcome, Dr. Sodhi.
Thank you for having me.
Yes, absolutely. I'm so excited. Dr. Sodhi is joining us from Scottsdale, Arizona, and she has a very unique boutique practice called Monarch Weight Loss and Wellness. And she's been practicing obesity medicine for almost a decade. She's going to share some evidence-based insights and also tidbits on exercise, nutrition, which you all know that I love these discussions. And from there onwards, we would love to know, Dr. Sodhi, something other than medicine. Like what's fun about you? Why did you pick obesity medicine? And anything that you enjoy or are very passionate about.
Yeah, that's a great question. So I started out the very traditional way in medicine, which was hospital-based internal medicine, but I was always drawn to kind of the wellness space. And in particular, I've had 3 pregnancies. And after each of those pregnancies, it was really a struggle to get back to what I felt like prepartum. And so it got me curious as to why that is and why different people would sort of, they say, bounce back, and then other people wouldn't bounce back as easily. And what were the driving forces of that? And then I started to study, different families and different lineages and different body types. And, why is it that certain people are more predisposed to gaining weight and keeping it, and then others simply are not? So it was out of that curiosity and my own personal struggle with weight that I came to study obesity medicine. And fortunately, it became a board certified specialty several years ago. So I sat for the boards and I dreamed up Monarch, which is my boutique practice, so that I could take care of patients in a way that I felt like was really fit, meaning it wasn't just writing a prescription, it was really holistically approaching them. Because I remember when I was postpartum and I saw my primary care physician, and most doctors don't have any training when it comes to obesity medicine or weight loss, right? And how to appropriately navigate that with their patients. So I saw my primary care doctor after my baby was born, and I said, "Look, I've got, this weight that I'd like to lose, and I'm really struggling, and I'm breastfeeding. It's not coming off. What's going on?" And she was a very petite person, and she just said, "Oh, drink some tea and it'll be okay." And that didn't work. So, it really drove home that there was a gap in the care for these individuals that really are struggling and they just want to get help. They just want to feel some compassion and get evidence-based care. And so I'm really happy to be able to provide that to the patients that I serve.
That's so impressive, right? When the personal experiences or the personal journey, it just helps us to figure out where is the void? Like, why is this question still not been answered? And why is this part of woman's phase of life not been addressed? And you being a physician, getting the answer from another physician about basically no solution to your questions or your concerns at that time. When you're talking about wellness, right? So we talk about evidence-based science, and even our podcast itself is Hormones and Hope, and where we're trying to integrate science and wellness. What does wellness mean to you, and how are you bringing that to your patients and your community?
Yeah, so I think wellness is a broad term, but to me, it means that your wellness routine, whether it's waking up at 5 a.m. or sleeping in or whatever self-care you're doing, is not adding stress, and it's actually adding longevity to your life. So what I mean by that is, can you, let's say with a cup of tea, if you're enjoying your tea, can you actually sit and enjoy it? Or are you doing it for the sake of, checking off a box? So a wellness routine is something that actually cultivates a relaxed mindset and a fit body. and not something that adds stress. I mean, that's the opposite of what we're trying to accomplish when it comes to wellness. So it's a routine. Wellness would be a routine that allows you to just relax and lean into the best version of yourself mentally, physically, and emotionally. For me, that means doing the activities that I love. So I love Pilates, I love lifting weights, I love tennis. So doing that regularly is part of my wellness routine. Relaxing with a good book is also part of my wellness routine because it just helps ground me. It helps center my mind over the subject matter that I'm reading about. So I think the wellness component can look very different for each individual, but it takes some time, sitting with yourself to discover what it is that makes you feel well and doesn't feel like you're adding stress. I know there's a lot of people that are maybe watching Instagram or TikTok videos and being told you've got to do 1,000 things for your wellness routine. I think you've really got to look at that and say, does this really apply to my life? Is this going to add quality to my life, or am I just trying to chase what some influencer is saying? So it's really important to know yourself and know what makes you feel your best.
Yeah, so true. And what better than having like a physician coach who can blend this and guide? So I'm glad your patients are very privileged to be under your care. Thank you so much. So, Dr. Sodhi, the way we start our podcast is we have a few rapid fire questions and a one liner or just one word answers. And if you wanted to deep dive into that, we could elaborate on those questions and answers after we are done with rapid fire. So, you're ready?
Yeah,
Okay. So, number one, true or false? Obesity is purely a result of poor diet and exercise.
false,
Thank you. Right or wrong? GLP-1 medications are just for weight loss.
false.
Thank you. Number three, yes or no? Can someone have a normal BMI but still be metabolically unhealthy?
That's yes, true.
Yes, thank you. Number four, true or false? Stopping GLP-1 medications always causes weight regain.
False, but it depends on the circumstances.
So we can elaborate if you feel like this needs a broader explanation. Number five, right or wrong? Muscle mass matters more than the number on the scale.
Correct. For the most part, I would agree with that statement. Yeah.
Number six, true or false? Once you start an obesity medication, you'll need it forever.
False.
Number seven, the last one, yes or no? Is obesity recognized as a chronic disease by major medical societies?
True. Yes.
Thank you very much. I really appreciate this because, muscle and some debunking some myths about medications needed for the longest term versus is there an individualized treatment. So, how about this, Dr. Sodhi, since we had some answers which may need an elaboration, if you can start with telling us about, what is the science of obesity and why is it like you yourself said the primary care physician that you were seeing probably did not have the understanding or everyone doesn't get the plethora of pathological mechanisms that are getting affected in this condition. So anything that can be simplified and you can add on to our knowledge today regarding the science of obesity.
Yeah, definitely. And I will start this by saying that don't know so much. There's so much to be uncovered still. Even when it comes to all of what a GLP medication can do, there's still so much to be discovered. But what we have uncovered in the past decade or so is that obesity is really a dysfunction of adipose or fat tissue. So, our fat cells are called adipose cells. And those are very hormonally active. And so, when those cells are not functioning properly, they essentially allow you to hang on to extra weight. And it can make it very difficult to break the cycle of weight gain because those fat cells are integral in regulating your appetite and how full you feel. And so when those hormones are off, no wonder it is difficult to lose weight. So that is a bit about what we know in terms of what obesity is. I haven't heard it defined in those terms until again, the last 10 years, I would say. But in medical school, they didn't talk about it. They just said it was excess calories, which I think was pretty tone deaf to say. And maybe it's because we didn't know what we know now. So really, it is at the level of the fat cells, but it's also at the level of the brain. So the brain is also responsible for a lot of the hormones that regulate our appetite, pleasure, all those things. And so when the brain is sensing that things are off, it also makes it hard to lose weight. There's something called the set point of your weight. I like to think of that as your thermostat for your brain. So let's say you like to set your house to 75 degrees. Same thing for your brain and the set point. It likes to see you at a certain weight. And so that's what accounts sometimes for that yo-yo dieting that people go through. They'll lose 20 pounds and gain it right back and lose 20 pounds and gain it right back and sometimes more because that thermostat is fixed, right? The set point is fixed. And so GLPs have been able to address this thermostat issue in the brain, but there are lots of influences on it that we don't even know about yet. So that's a little bit about what we know right now. I think in the next decade, we'll come to know even more about the disease of obesity and how to, potentially cure it. Right now we're working on mitigating it and regulating it as best as we can. But I think that there's a lot of studies being done to really evaluate how can we get to the other side of this disease that plagues so many of us.
Yeah, absolutely. And it's something that is also described as, a chronic disorder, just like we have type 2 diabetes, mellitus, all the incidence and prevalence of both these conditions rising in the last, almost 30, 40 years with the and it's steeper. In endocrinology, like during our fellowship, we had, the mechanisms explained for obesity, and that was for a lot of genetic syndromes where individuals had this disorder as a part of their, altered genes or the inheritance pattern. And then how much we could learn about the environmental exposures that contributed to these gene alterations, which was more related to external environment. And of course, in many individuals, it was also what was lacking in terms of physical inactivity and the poor nutrition choices. But like you said, it is, we still don't know. And as much as we are aware of now and as much science and evidence we have, there is a lot that we can offer patients today as compared to, a decade ago. So thank you for sharing that. With your background, you probably have when patients come to you, right? And usually they will have this complaint. It's either it's weight related or it could be metabolic health related. But I also wanted to add, if you were okay, because you had this personal experience. So, what was your journey in terms of transformation that really convinced that these are the steps that are needed for someone to approach weight management or weight loss techniques? And then we can go into the medication realm also.
Yeah. So I grew up in what I call the Kate Moss era, where it was in vogue to be very, very thin. And what I didn't realize as a young, let's say, teenager, college student is that that's not a realistic body type for most people. Now, for her, maybe, right? We don't know. But for a lot of us, that's just not realistic. And there was no emphasis on what we were made of, meaning muscle mass versus fat mass. And I wish I had known that going back there. So, keeping that Kate Moss ideal in my head, I had gone through so many different types of diets to lose weight when I maybe didn't even need to lose weight, if we're being honest here. And so Atkins, keto, low fat, I mean, all there are all these trends, right? Every couple of years there would be a new trend and I would buy the book and I would try the diet and maybe I'd lose 5, 10 pounds, but nothing would stay off. It would just come back. With my pregnancies, again, the first pregnancy was okay. I seemed I'll call it bounce back relatively quickly, but I didn't put muscle on, right? So keeping that in mind, I went into my next pregnancy probably the same weight, and then I didn't easily lose the weight, even though I was doing all the same things, breastfeeding and all that. And that's when I really started working with a coach who dialed in on my nutrition and had me realizing the importance of not fasting when I wasn't eating properly the rest of the day. At that time, I was actually eating most of my calories in snacks. So now I have a keen eye for that in my patients. I just wasn't eating proper meals. So through that coaching is when I realized that proper nutrition was what I needed, right? And then layering, and I was also in training from, residency at the time. So Managing my stress to the best of my ability was also key. Getting adequate sleep was also key. And what I've learned over the years is that none of this is a quick fix. It takes time and habit stacking to really get to the end goal that you would like. And maybe there isn't quite an end goal. It's an evolution that we're all going through to optimize muscle mass. And now, to be honest, I don't even really step on the scale that much because I really just want to know how much muscle mass I have and that I'm growing that. That's my objective nowadays. I realize finally, after decades of this, that like you were asking me in the rapid fire questions, the weight on the scale doesn't really matter that much. What you're made of is what matters the most. And the scale, the plain bathroom scale, won't really give you a great breakdown of it. For most people, it can be quite triggering because they have this number in their head. Oh, I was 130 pounds in high school. I must get to that. And for many people, it's just not realistic, right? Our metabolisms do have a natural evolution, and so does our body composition. And our goals at 20 versus 30 versus 40 and onward, they're going to change, right? And so you just have to kind of go with the flow and do the best you can for your body. So that's been really my transformation has been learning that there's no quick fix. What you do to lose the weight is typically what you need to continue to do to maintain that weight loss. So I tell people ask me, what's the best diet? And I say the one that's going to feed you nutritionally, but also the one that you can stick with long term. Not a fan of a quick fix 5 pound weight loss diet. I don't think that is sustainable or good for our mental health either. So I think longevity is really what I've come to learn in my years of my personal experience is that we're going for longevity and not a quick fix. Mhm.
Yes, so insightful. And, it opens our eyes like as adults, and especially when you are bringing this to your patients and even to our audience, the perspective, right? The perspective, we just switched it from not the scale, but also your body composition.
Yeah, I think it takes a lot of time. It takes a lot of time to let go of that number on the scale. 'Cau and then I have some patients that maybe achieve the weight that they wanted to achieve, right? They lost the weight and then they realize, "Oh, this doesn't exactly feel like it did 20 years ago." And I'm like, "Because you're a different person. Like, you've evolved, and now you may want to build some muscle, and you may actually want your target weight to be higher than what you before." So, it requires a lot of introspection and thinking about what your goals are. I think we've got to think beyond the scale and think about some metrics like I want to be able to lift my grocery bag. I want to be able to lift my grandchildren, those kinds of points and, not get injured while doing so. So I think those could be really helpful in reshaping what's realistic for you on your weight loss journey.
Yeah, I 100% agree with you. This was, yeah. I just love when there is so much, yes, like-mindedness, but also same emphasis with, which is of course backed up by science and your personal experience and your professional experience. It touches more hearts and more brains because we have, like you earlier mentioned about all the influencers out there, all suggesting, quick fixes, but the reality check, the longevity is a long game, not a short game. So now we know the science, or at least we have an understanding of the science and the meaning of what are we just looking at in terms of when we talk about obesity or weight in general. We are looking at more of our body composition with the medication, right? So going to pharmacological interventions. Now, as endocrinologist, I think it was 2005 or so where we had the first GLP-1 exenatide approved for type 2 diabetes. And since then, we've had so much of evolution, like so many generations and much better medications in terms of their efficacy and the outcomes. So from your standpoint and your expertise, when do you bring this in your discussion with your patients when they are working on their wellness plan, when they're working on their lifestyle interventions? They've been focusing on their body composition, but they are, so-called they're stuck or they're not able to achieve an outcome which is metabolically healthy. So not just the weight. So how do you bring this in their discussion during a patient-physician visit?
Well, I will say a lot of patients, because of their widespread notoriety, they're bringing it up with me. Sometimes on the first visit, But sometimes they do express concern and they say, "Oh, I don't know if this is right for me, and I don't know if this is the way I want to lose weight." And I say, "No problem. In my book, I would much rather let's optimize your lifestyle, right? Your sleep, stress, nutrition, movement, and then see what we need to do at that point." Some people have the patience for that, some people don't, and there's no right or wrong answer because if you look at it, it's like I never want to be the barrier between someone and a medication that could be really pivotal for them. So, if a little bit of weight loss makes moving easier, or sleeping easier, or nutrition choices easier, then maybe the medication comes first. If they feel empowered to start doing those things ahead of time, we can optimize that and then layer the medicine on as we go. I'd love to do the latter for most people because it just helps teach them that confidence that the medicine is a tool and they are doing the work. They're looking at their so-called wellness routine, which takes a lot of time. But in the former case, if they just are feeling like there is a hurdle in their life and they just need medication to help facilitate getting through that hurdle, I'm not opposed to that either. So the conversation about medication oftentimes is brought up by the patient. Sometimes it is brought up by me, especially if they are optimizing sleep, stress, nutrition, movement, and they are feeling like they're in a plateau of sorts. Then I will bring it up with them and I'll say, this is something that may actually help show the efforts that you're making. It's not going to do the work for you, but it's gonna help kind of unlock all that effort you've been putting in. So because a lot of this is also staying in it for the long game. Mentally, you've gotta be tough. And so if you're doing all this work, like, let's say you've had years of dieting or years of this and listening to all these, influencers or fads and nothing is working, you may just throw the towel in. Sometimes medication can really help get around that, so to speak, because you feel like everything you do doesn't work. But that doesn't mean that the work you did didn't count. Just means that now it'll show a little bit better. I hope that kind of resonates, with you and your
Yeah, absolutely. Yes. So, it's even in clinical trials when medications are used, right? They are going through good intensive lifestyle interventions. It's not just the medication and you see the outcomes and everyone's just achieved their end result and their happiest ever. But it is these small steps, habit changing, is what's really bringing about the transformation as well. Yeah, absolutely.
exactly. And if you're using the medication, without really implementing intentional strength and intentional nutrition especially, you're not gonna build muscle, you're probably gonna lose muscle, and that can lead to problems. And so we don't wanna create more problems by giving you a medication. We wanna actually optimize your body composition so that the medicine just helped facilitate you getting from point A to point B. But we don't want the place you're going to be less muscle and a smaller body that's not helping anyone. We actually want to facilitate a higher metabolic rate, more muscle, so that your long-term health outcomes are achieved.
Yes, absolutely. So, would you have time and the willingness to share or just walk us through? So, you're seeing a patient and an example of what certain pillars that you're addressing. In I would specifically be interested in movement in the muscle mass because that's very very essential. And then comes nutrition, stress management, sleep. So, how would you have this conversation? And if they are getting a prescription of the pharmacological medication that is the GLP-1 receptor agonist or the dual agonist, how are you complementing these? So it could be a patient story, it could be some transformation that you've experienced in your patient care, but just someone to visualize it if they're watching it on YouTube or when they're listening to the podcast. For them to like really understand or comprehend how are you blending the science and wellness.
Yeah. So one patient that comes to mind has done a lot of marathons actually, but has felt in the last several years after having 3 kids, it's just been harder to lose the weight. And she was technically, I believe, in the obese category of weight, which is a BMI of 30 and above. Can't tell you exactly what her weight was, but she was still running marathons. So cardiovascularly, very fit, but was carrying extra adipose tissue. And what she was doing when I evaluated her for the first visit was she was doing all cardiovascular activity. So she would run 7 days a week and no strength training. And so she was really good at running and had really great race times, but not very much muscle mass. And so we had a long, detailed conversation about how stopping running 1 or 2 days a week and supplementing with strength training could be really good for her. And it was hard for her because, quite honestly, she was addicted to the running. And it's great for your mental health, it's great for your cardiovascular health, but we still need to strengthen our muscles. And the running is not going to do that. You need weight bearing exercise. So I had to really comb through that with her and explain to her why actually loading her muscles with weight would be beneficial to her and actually help her with her running and help prevent injury. And so it took a few months actually of back and forth about did you lift weights this week, or what works for you, what doesn't work for you? And slowly she was actually able to weave in 5 days a week of strength training, and she reduced her running time and added the strength training in. Because she realized that as she was losing weight, and I'll add in the GLP later, um it helped her. It helped her to run better. It helped her to recover better because she was more muscular. And so in the beginning, we talked about this plan, and I said, we can do the GLP, but I want you to really be intentional with your strength training and focusing on protein. That was the other thing that she wasn't doing very much. She was having, which, that we could get into the macronutrients, but she was having a significant amount of carbohydrates, which was fine. She was a runner, and obviously you need that to be active, but we also trained her to focus on protein as well to help build the muscle that she was going to grow with the strength training. And so the combination of strength training plus the GLP allowed her to actually reduce her weight, reduce her body fat, and increase her muscle mass. So she's been really happy with the results. We've been working together for a year, and that's been really transformational. But it required a very detailed history of what are you doing, because this is someone that in a one-liner would have told me, "I'm doing all the right things. Why am I not losing weight?" But the right things to one person are not the right things to the next person. And so we have to take that detailed history. We do wanna know, are you running versus weightlifting versus Pilates? I hear that all the time too. Like, people think that Pilates is gonna help them build muscle, and I tell them it would be tricky to do that. I'm not denying that it's not possible, but for most people, they're gonna need more than just their weight to gain muscle mass. And so Pilates is great for flexibility, for balance, for posture, for mental health, all that. But I always say picking up an actual dumbbell or doing some push ups, nothing compares to that quite when it comes to building muscle mass. So you really need to get into the weeds with your patients about what are they doing and what do they consider muscle strength building exercise. Maybe they're thinking their running is doing that for them. So it's really important to get that history from them. And this is why a lot of us that are trained, in obesity medicine, lifestyle medicine, endocrine, we ask all these questions so that we can understand what you're doing, what feels good to you, and honor that. I don't want to take it away from you. I just want to complement it with something that'll help you gain strength. So I think when you do it in that way, it's really strategic with coupling the GLP plus the strength training, you can have really great outcomes.
Yeah, I so agree with you. These things are not published yet. That is there a chance to, I think this was in a rapid fire, to wean them off or, discontinue safely and still not have massive weight rebound, like a regain, basically, for patients who are, somewhat similar in terms of the storyline that you mentioned or the phenotype that you just talked about. And as clinicians, I think you would probably echo the same experience. We do have possibilities, especially when they're gaining muscle and they have modified their habits in terms of the wellness pillars that you were talking about. And if they needed the support of these medications, there is a higher likelihood of them weaning off or discontinuing, especially with a lower BMI, like it's not BMI of 40 or above. I've had those lots of successful stories, and I was curious if you had, because you mentioned that it's not necessary for someone to be on these medications lifelong in a rapid fire.
Yeah, I get asked this a lot by patients because they say, I don't want to be on it for a long time. And I never make a guarantee because I say, I don't know. I don't know your body as well as your body knows your body, and what's going to happen. But I do know that if we can stay on an appropriate dose for you, right? And we can do everything in our power to increase your strength and optimize your habits, you have the best shot, no pun intended, of coming off the medication. But if you do nothing, like there are people that have asked to work with me that just want the medication, and I have an honest conversation. I say, "This is not a good fit." If you just wanted a shot, unfortunately, there are a lot of places you can go for just that, which is not gonna give you wraparound care. But if you're doing that scenario where you're just getting a medication and you're not implementing the lifestyle intervention, then yeah, you can expect to gain the weight if you stop it because you haven't done anything to your biology, right? You haven't done anything to reverse those habits to keep the weight off. So it's just like if you did the keto diet for 6 months and then you stopped abruptly and went back to the way you were eating before, you're probably gonna gain the weight back, right? It doesn't just miraculously stay off because that set point is there, right? We haven't changed that. So if we build up our muscle mass and we optimize our all the conditions for which our hormones will work optimally in, meaning stress, sleep, nutrition, all that, then we've got the best chance. But if we do nothing, then yeah, you can count on gaining it, I would say. That's more true, is that you can count on gaining it if you've done nothing. And also the other thing is not abruptly stopping it. Like if you're on one of the higher doses, you also wanna think about reducing your dose in a gradual manner if that's appropriate for you, talking to your doctor about that, so that there is some time to adjust and really feeling like, is that hunger coming back like this, or is it a slow kind of adjustment? You wanna be aware of that, and it's different for every person.
Yeah, so well said and explained. I just wanted to remind the audience, GLP-1 receptors are FDA approved for other reasons. Right now, we're not talking about GLP-1 use for patients with type 2 diabetes and weaning off there, but we are specifically focused on the chronic disorder obesity, which is currently defined based on the BMI scores. So thank you, Dr. Sodhi. Do you have any last minute, like key concepts of, I really loved the way you said, like, how do we perceive ourselves, what's our weight and then the body composition, why muscle strength and muscle mass is so very important when we're looking at our health as well as longevity. But any simple steps that someone can start with if they are already getting plethora of random information from the world out there in the internet and the AI world, but what simple steps that can help them to seek the right medical care, to start a certain or make certain changes in their daily routine to get to a better body composition or better health metabolically?
That's a great question. I would start by documenting what you're doing currently. So keep a journal. Like I'm a pen to paper kind of person. Some people like the notes app on their phone, but I would just write simple like BLD, breakfast, lunch, dinner, and S, snack, and just jot down what you're doing, what your intake looks like. Try to be unbiased and just do it for like 7 days and then reflect on it and take a look at like, well, how much protein am I getting and what could be better rather than knee jerk making changes. I would really look at what you're doing first and then tweak. Like, just it's a constant reevaluation. And now doing this with the guidance of someone that has training in obesity medicine would be optimal, but this is something you can absolutely start on your own. The accountability and the advice of your doctor is also definitely recommended, but there's nothing stopping you from just creating that log and bringing it to Dr. Makisha or whoever you're seeing for your obesity or metabolic health optimization and showing them, like, this is what I'm doing because that's how they're going to be able to best help you. What I find doesn't work is a complete overhaul. For a lot of people, that's just overwhelming. And so I love to meet people where they're at. So what I would recommend is just jot down what you're doing. There have been studies that show that just documenting your food in a journal can help you lose weight. So just doing that because it brings the intention to it and the accountability to yourself. So I would recommend just keeping that journal and then, week over week looking at it and saying, okay, last week I had cereal or toast for breakfast every morning. Maybe I need to add a little protein to that. And so maybe this is actually a matter of adding to your plate rather than subtracting. And so you'll identify patterns only if you zoom out. Day over day, you can get in the weeds of what you're doing. But if you've got a week's worth of data to look at, it's easier to identify patterns and where there's room for improvement. And then when you're going to the grocery store and you want to optimize, let's say, your protein, you can say, okay, I need to buy more tofu or more chicken or more whatever to meet my protein needs rather than day in and day out being like, oh, I did terrible today and not really having a way to fix it or correct for it. I think it's important to look at the overall trend and then make small pivot every week.
I love that. To start with journaling, that's for all of us, even if you just wanted to get healthy or live longer or have a positive mindset. Wonderful. So, Dr. Sodhi, this is great. I could just imagine like how lucky your patients are because there's like everything that is done by the physician, by the specialist. You're the coach, you're the mentor, you're guiding them, and of course, helping them to achieve that transformation. So, please tell us if our audience or if their family members or anyone listening or watching, if they wanted to reach out or get expertise from you, how could they reach you or how could they follow you?
Yeah, thank you. I have an Instagram page. It's at Dr. Mona Sodhi. And then I do see patients that are located in Arizona and Pennsylvania. And so for those of anyone that might be interested, it's monarchconciergewellness.com. There's also a link to that from my Instagram page. So those are two ways you can find me.
Thank you so much. This was very insightful, and I'm looking forward to have near future discussions on the wellness aspect of obesity medicine, and of course, dive into if we need to, or if people are interested into the pharmacological therapy and just the nuances of the side effects of the mechanism of action, what to do, what not to do. But until next time, I really, really, I'm grateful to you, Dr. Sodhi, and thank you everyone for listening and watching.
Thanks for having me.